a business. I'm a businessman and in partnership with New Life International. So today we are going to discuss about bone and joint health. When you look at what causes these diseases like arthritis, these chronic diseases, one of them being arthritis, you find these are non-communicable diseases, and the best thing we can do is to prevent. So we are going to discuss about bone and joint health, and because without bones, you cannot move, you cannot do anything. Remember, every person, we have a skeleton. That means bones, they support us in movement and they support our body, because without bones, you cannot do anything. You can't move, you can't carry anything. So we have to take care of our bones. So first and foremost, according to research, they tell us that for us to live long and healthier, free from these chronic diseases, the number one thing is to do exercise and to manage our weight. The number two is eat food rich in whole food nutrients found in whole grains, fruits, vegetables, and fish. And also have enough rest. So when you look at our diet today, you find we suffer from bone diseases, bone and joint diseases, simply because of poor nutrition. And for us to maintain our bones or to have a health bones and joints, number one, we have to do exercise, physical exercise, and we have to manage our weight. Number two, we need rest, because through resting, you find these muscles, they relax during at night. And number three, which is I'm going to talk about, good nutrition. So first and foremost, we are going to look at what causes bone and joint problems. According to research, they tell us that number one, the main cause of these bone and joint problems, it is lack of certain minerals. And that is poor nutrition. Number two, obesity. Being overweight or obese cause more problems, our bones and joints. And another thing that causes these diseases, bone and joint problems, alcohol consumption. You find most people, they take alcohol. And another thing is caffeine. This most caffeine, you find it in most soft drinks. Then family history, you find if your mother had a challenge of bones, automatically you know what a mother feeds on. It is the same. It is the same that feeds the child in the womb. So family history is also the cause. And hormonal changes. As you age, our bones tend to be weak because of lack of certain minerals like calcium, magnesium, and other minerals. Then high consumption of fats and sugars. According to research, most people, they tell us, according to doctors, they tell us that taking a lot of sugar, white sugar, depletes essential minerals from our body. Most importantly, like vitamin Bs, like B1, B6, B9, B12. So after knowing the cause, we have to learn how to prevent. For us to prevent osteoporosis and bone and joint problems, number one, we have to avoid stress. So we need to avoid stress. We need to avoid soft drinks because they contain sugars. We have to avoid smoking. We need to avoid, and we need to avoid yeast products. And what are the main cause of osteoporosis? It is because lack of calcium. Because when we lack calcium, the blood keeps on picking calcium from our bones, and when calcium reduces in our bones, you find the bones start to weaken. So I've talked about the cause being hormonal changes. According to research, they tell us that as we age, women and men tend to decrease. Women decrease in estrogen hormone in women at time of menopause, and also it decreases testosterone in men decreases as we age. Then having certain medical conditions that cause increased inflammation in our body can also cause osteoporosis. So then arthritis. What causes arthritis? Because you find arthritis, it is a bone disease. It attacks what? Arthritis. The way I can term the word arthritis, it is the inflammation of the bones. And when you look at the category of arthritis, it is in the category of autoimmune diseases. That means if you don't eat well, if you don't eat fruits and vegetables, that means your immunity will become low, and it can be one trigger that causes what? Arthritis. So we need to boost our immunity. You boost your immunity by doing exercise, by eating a lot of fruits and vegetables, and by taking a lot of water. So we need water, a lot of water, fruits and vegetables, and also doing exercise to manage the weight and also to strengthen our bones. So you find that when you have like arthritis, you find we have a challenge of joint pains. Then another thing, you find we have a challenge of breakdown of cartilage. Then another thing, being overweight and obese, it causes the what? The osteoporosis. And our research shows that by taking this medication, I've mentioned about medication conditions, too much medicine, you find painkillers, most importantly painkillers. Painkillers, sometimes they don't treat the main cause, but they treat the symptoms. They treat the pain that you have, but they don't treat the cause. And too much painkillers, according to research, they cause some kidney stones, and also you find your immunity becomes low. So we are going to look at the solution. Now we have known the cause. We have known what to avoid: soft drinks, smoking, sugar, too much salt, and they tell us to limit high consumption of citrus fruits, and also and avoid yeast products. So we are going to look at the recommendations for us to have strong bones and teeth, have strong bones, healthy joints, and teeth. Number one, we need the TNN. Because remember, I've told you that for us to live a healthier life, we need to eat a lot of whole grains. Why? Because in TNN, remember also bones have cells. Like most people, they get leukemia simply because you find cells you find white blood cells in the bone marrow. You find those red blood cells. They need to be fed, they need to be protected, they need to be repaired. And what threonine does, it feeds all the cells that we have in our bodies because it contains lipids and sterols that feeds our cell membrane to remain soft and permeable to allow the nutrients that we get from the food like calcium and other things to enter into our cells, and also toxins or wastes to get out of the cell. So the number one product that we need, the number one solution that we need for us to have strong bones and healthy joints, we need threonine. What threonine does, it feeds our cells and it increases nutrient utilization efficiency by 50%. The second product that we need for us to have strong and healthy joints, we need omega-3. Why omega-3? Because omega-3, it has good fats. And according to research, they tell us that when you take omega-3, clinically, it is clinically proven to lower inflammatory index by 68% in just 8 weeks. That is 2 months. So to avoid inflammation in our joints, because when you don't have enough synovial fluid in our joints, you find the cartilage starts to break down because omega-3 works as oil in our joints. So it fuels our joints and it reduces inflammation. That's why for us to have strong bones, we need omega-3 because it reduces what? Inflammation. Another thing that omega-3 does, it cleanses arteries. We have small vessels that supplies blood in the whole body. So it cleanses arteries. That's why we need what? Omega-3 for us to have strong and healthy joints. Then another product, omega does very many things, but now I'm going to focus only on joints. So you find most people, they have a challenge of inflammation of the joints. So that means when you take omega-3, what will omega-3 help us? Omega-3 reduces inflammation. And another thing, omega-3 helps people with the challenge of rheumatism, arthritis, and gout. So gout is a disease whereby you find someone have what we call inflammation or swelling in the feet or in other joints. So omega-3 is the one that reduces the inflammation. As I've told you that it is proven, it is clinically proven to lower inflammatory index by 68% in just 8 weeks. Then it relieves body pains and aches. One of our distributors used omega-3 and he gave us testimony that when you take omega-3, it massages all the body. If you have any pain in your body, then omega-3, it will help you to do what? To relieve and also pain in the joints. Then another product that we need vitamin D. Why vitamin D? Because vitamin D improves the calcium absorption. Vitamin D helps us to boost our immunity. It is also good for eyesight, but I focus only on joints. Then we need magnesium, because magnesium, it is good for muscles. It helps our muscle to function very well. It promotes muscle function. And also, it helps calcium absorption. So that's why in our program, we have a product called chelated karma. Number one, chelated karma, it is excellent, it is recommended. It is excellent for strong bones and teeth. Then another thing, it calms the nerves. Remember, nerves is like the wiring of the body. So it is needed for transfer of nerve impulses. So it prevents osteoporosis. When you take calcium, it helps everyone, or it helps us to prevent osteoporosis. Then calcium is good for blood, for it prevents muscle cramping and also tooth decay. Muscle what? Then it improves heartbeat and also muscle activities. Remember, when you are walking, muscles, some people, they get muscle pulls. So if you find someone with muscle pull, just give that person calcium, chelated karma. Then when chelated karma is also good for pregnant mothers because it helps the child in the womb to grow very well, very well. And it is also needed for breastfeeding mothers. Calcium is also good for breastfeeding mothers because these breastfeeding mothers, they tend to lose a lot of minerals because they feed their young children when they are doing what? They are feeding them. So they need what? Calcium. And if a pregnant woman takes calcium, it is good for childbirth. Childbirth easier for what? For ladies. You find they spend less time in labor ward if they start taking calcium at early stage after getting what? After conceiving. One of the products that those pregnant ladies need, number one is calcium, number two is vitamin B complex because of folic acid, and number three is omega-3 because omega-3 is also it works on it helps on improving the brain of the child. Then another product, calcium is also good for, it helps in blood coagulation. So you find these ladies in their time of birth, they tend to breed a lot, and some of them they die because of overbreeding. But when they take calcium early, you find the calcium helps the blood to grow very quickly. So it stops overbreeding. Then another product we have for strong bones and joint health, we have full motion. Why full motion? Because full motion, it contains a mineral called glucosamine. And glucosamine is a mineral that helps to rebuild, repair, and regenerate cartilage. Then full motion, it also reduces pain and also other symptoms. Remember, most people with bone and joint problems, they tend to tell you that they tend to tell us that they experience a lot of pain, backache, joint pains. So full motion, it helps to rebuild the what? The cartilage in our joints. So who should take these products? Everyone, because all of us, we have bones and we need to have strong bones and what? And teeth. We need to have good muscles to strengthen our muscles. That's why everyone needs to do what? To use these products because they help us to have strong bones and also healthy what? Healthy joints. Why do we need calcium? For example, according to research, they tell us that ladies, because they go into monthly periods, they tend to lose a lot of calcium every month. Every month, ladies, they lose a lot of calcium during their menstrual periods. So according to research, they tell that ladies, they need 1,500 grams of calcium every single day, because you find for you to get those grams of calcium, according to research, they tell us to eat 8 glasses of fresh milk, which is impossible, or 2 glasses of local yogurt. The more you take it, the heavier, the more fats you accumulate in your body. Then at the end of the day, the result is pressure, obesity. So yogurt is good because we get calcium from yogurt. But if you take too much, you become overweight. So when you become overweight, you remember your bones cannot carry heavy weight. So that's why there is advantage and also disadvantage. The solution is to supplement. So ladies, they need 1,500 grams of calcium every single day. And research shows that for us men, we need at least 99 grams of calcium every single day. But look at your plate. The foods that contains calcium, do you take them? Foods that contains magnesium, because we get magnesium from leafy vegetables, green leafy vegetables. Talk of broccoli, spinach, radish, beetroot leaves. Those things, you find we cannot take them every single day. I don't know you, but for me, I don't take them every single day. Though I know that I should take them, but you find it is difficult to get them. The way we prepare our vegetables, it is also a different story, because the more we cook these vegetables, the less we get what? The minerals. So the reason why we need to supplement it is because even if you try to eat well, you cannot give your body all the nutrients that it needs, like calcium, like magnesium, and also we get vitamin D from like mushrooms and also sunshine. But most of us, we spend a lot of time in where? In the buildings. So you find our immunity becomes low and also joints also. So the reason why we need to supplement with these products is because we don't get enough of the nutrients that our body needs. Number two, soils are depleted. Even if you try to eat those greens and vegetables and whatever, minerals in the soil, they are not there. Farmers today, they use a lot of chemicals. They use pesticides, they use fungicides, and according to research, they reduce essential minerals from our vegetables and also fruits. Then pesticides. You cannot grow tomatoes, you cannot grow this spinach or these other fruits without spraying them. That's why we need what? Too much sugar depletes essential, valuable minerals in our bodies. So we need to supplement. Most importantly, calcium. And another thing, we use saucepans. And they say aluminum cooking utensils, they reduce what? Essential minerals from our food. I don't know. Is there anyone who cook food using our local whatever? Or we use aluminum saucepans? That is the reason also. So all of us, we need to supplement, because when you supplement, you give your body the right nutrients. If you give your body the right nutrients, it has the capacity to fight or to heal itself. So we need to, if we need strong bones and healthy joints, we need to supplement with these key products that I have mentioned. Number one, threonine. Number two, omega-3. Number three, chelated carmac. Number four, full motion. You can add on like vitamin B complex and garlic, because garlic is also good for bones because it prevents arthritis. Garlic, allium complex. Remember, most people, when they get the challenge of arthritis, there's some bacteria you find and garlic is a good antibacterial product. It kills those bad bacteria in our bloodstream or in our gut. So that's why we add on what? Garlic on those products. If you meet someone with a challenge of knees and whatever, you have to add on some garlic. If money is enough for that person. But if money is not enough, you consider 4 products: TNN, omega-3, chelated caramel, full motion. Those are key products. And if you don't have any challenge with bones and backache, still we need to use these products, because to maintain our structure, to maintain our bones, we have to use those products because they help us to have strong bones and healthy joints. Thank you very much, Mr. Justice. If there is any question, someone can ask. Thank you.